Concept 24, Inflammation. Goals for this concept presentation: define and describe the concept, notice the risk factors for inflammation, recognize when an individual has inflammation, provide appropriate nursing and collaborative interventions to eliminate inflammation. Definitions: inflammation is an scope and categories. Scope of inflammation can include no inflammation or all the way to the right with the arrow to acute inflammation, active inflammation, which is acute, chronic, and restorative. Categories of inflammation: acute, chronic, or repair. Acute inflammation is immediate, short, and there are 5 cardinal signs, which are pain, heat, redness, swelling, and loss of function. The chronic inflammation can be weeks to years. Repeated tissue damage and repair can be localized or systemic. And then there's the repair restorative category. Local manifestations include swelling, pain, heat, redness, exudate. Could be serous exudate, fibrinous exudate, purulent exudate, or hemorrhagic exudate. Systemic manifestations can include fever, leukocytosis, increase in plasma proteins, malaise, and fatigue. Physiological processes can include positive or negative outcomes. Positive is restitution of normal functioning cells following injury, fibrous repair when functional cells cannot be restored. Negative outcomes would be overly severe response to the stimuli, inadequate response, which causes chronic inflammation. This process involves white blood cells from the immune system that are attracted by chemotaxis initiated by bacterial neutrophils, viral exotoxins, lymphocytes, parasites, eosinophils. Also degenerative byproducts of inflammation, complement system activation, plasma clotting products. Pro-inflammatory hormones, such as mediators, are prostaglandins, cytokines, and histamines. The acute inflammatory response, again, is tissue injury, which is release of chemical mediators, vasodilation and increased blood flow, swelling and retraction of activated endothelial cells, increased vascular permeability and leakage of small plasma proteins. Fibrinogen becomes fibrin, walling off, movement of immune response cells to the site of the injury, exudate formation, movement of glucose and oxygen to the site needing repair, and release of chemical repair factors from activated endothelial cells. Chronic inflammatory response is macrophages releasing thromboplastin. It facilitates hemostasis and promotes fibroblast activity. It removes necrotic tissue and foreign pathogen material. The healing process is interrupted by re-injury or renewed inflammation and immune system activity. This may be subclinical, no symptoms, evidenced by elevated CRP, which is the C-reactive protein, also increased ESR, which is erythrocyte sedimentation rate. The response depends on the degree of injury and the host's resistance. Acute versus chronic inflammation. This is showing you examples. Acute inflammation includes allergic reactions, chemical irritants, infections, trauma, injury, burns, lacerations, cuts, wounds, and frostbite. Chronic inflammation is cardiovascular disease, neurological disease, autoimmune disease, rheumatoid arthritis, cancer, lupus, fibromyalgia, and chronic fatigue syndromes. Acute inflammation versus chronic inflammation. Innate immunity describes acute inflammation. There's a stimulus. The immune helper cells do their job of healing, and it ends the stimulus and it heals. Chronic inflammation is called adaptive immunity. It's an ongoing stimulus where immune helper cells try to do their job of healing, but ongoing stimulus results in more cell recruitment, increased inflammation, and changes to the cells. This is a repetitive cycle and increase in disease process, and it's a circular pattern with chronic inflammation. Exemplars of inflammation. Acute inflammation. Exemplars are acute infection, bacterial, viral, fungal, or parasitic, bronchitis, burns, bursitis, foreign body injury, insect bite or sting, joint sprain or strains, nephritis, rheumatic fever, tendinitis, and traumatic injury. Chronic inflammation is atherosclerosis, chronic infection, chronic obstructive pulmonary disease, cirrhosis, diverticulitis, fibromyalgia, and gingivitis. Also, inflammatory bowel disease, myocarditis, osteoarthritis, psoriasis, and vasculitis. Autoimmune-based inflammation would be asthma, Crohn's disease, Goodpasture syndrome, Graves' disease, multiple sclerosis, myasthenia gravis, rheumatoid arthritis, and systemic lupus erythematosus. Excessive or ineffective inflammatory response. Local tissue damage from compression comes from nervous system injuries. Hypersensitivity reactions occur from allergies and autoimmune disease, and systemic pathology would include atherosclerosis, chronic renal disease, neurological disorders, and shock and multi-organ failure. Risk factors, populations. They can affect all individuals regardless of age, gender, race, and socioeconomic status. Risk for a severe or ineffective inflammatory response includes those very young or very old, or uninsured or underinsured. Risk factors coming from an individual would include autoimmune diseases, allergies, compromised immune system, genetics, hygiene practices, and environmental factors. Inflammatory diseases in this category would include cancer, cardiovascular diseases, Alzheimer's, diabetes 2, arthritis, autoimmune diseases, neurological diseases, and pulmonary diseases. Your assessment would include a history, the nature of the trigger, was it a recent injury, are they allergic to things, infectious agents, patient's ability to respond, specific symptoms and signs, duration and treatment, examination of local inflammation and possibly systemic. Common laboratory tests include non-specific tests would be a CBC, a WBC with diff, a CRP, and an ESR. Specific would be serological tests to detect specific antibodies or viruses. Radiographic studies include MRIs, CATs, PET scans, and colonoscopy. Clinical management. Primary prevention is reducing risk for injury and infection, maintaining good hygiene, properly using safety equipment, properly storing and preparing food. Secondary prevention would be there's no specific screening tests for this. Collaborative interventions include rest, ice, compression, elevation, which is known as RICE. This is the most helpful after sprains, strains, or trauma. Helps minimize swelling. It's the most beneficial for the first 24 to 48 hours after injury. Also, immobilization devices. Pharmacological agents include NSAIDs, steroidal agents, monoclonal antibodies, antipyretics, analgesics, and antibiotics. Interrelated concepts include infection, immunity, stress, fatigue, clotting, gas exchange, thermoregulation, and tissue integrity. The causes for the inflammation would be infection and immunity, and the effects are the tissue integrity, thermoregulation, gas exchange, clotting, fatigue, and stress. Your answer should be white blood cells. Question 2. Which of the white blood cells are most prominent in inflammatory response to viral antigens? Neutrophils, eosinophils, basophils, or lymphocytes? Your answer should be neutrophils. The cells that release tissue thromboplastin to facilitate hemostasis and to promote fibroblast activity are monocytes, lymphocytes, macrophages, or phagocytes. The answer should be macrophages, number 3. This is the end of the slideshow.